Welcome back to the Give a Care podcast with me, Sharon C. Newman. If you're currently navigating a complex neurological diagnosis, whether it's managing seizures, understanding early stage dementia, or dealing with the progression of Parkinson's, you know how quickly clarity can turn into chaos. The medical world often feels fragmented, and getting a clear, holistic picture is incredibly difficult. Today, we're solving that problem. I am honored to welcome Dr. Jessica L. Wilson Mohammed, a board-certified neurologist at Loyola University Medical Center. Dr. Wilson Mohammed is truly exceptional, a Chicago native who has practiced across nearly every major system in the area and is triple board certified in neurology, clinical neurophysiology, and epilepsy. But what makes her insight essential for caregivers is her approach. She's a comprehensive, holistically balanced general neurologist. We're going to bridge the gap between highly specialized knowledge and the real world day to day challenges you face. We'll be talking about advocacy, what data you must track for your doctor, and how to look beyond medication for long term well being. Welcome, Dr. Jessica L. Wilson Mohammed, MD. Thank you, Jesse. And I'm sorry I'm calling you out of your name right now, but it is only because I'm so familiar with you.
Absolutely.
And I think that we're friends, and Jesse just comes out naturally. So I'll be respectful to the audience.
Jesse
Please
is
welcome
fine.
Dr. Jessica Wilson. I consider her a family friend. I consider her someone that I can talk to, about different things. And so I wanted to I am honored that you are taking this moment to come on and share with the audience your knowledge, because you are a wealth of knowledge. And I am like, she got so much to offer the world. Let's get her on. So first of all, how are you?
Doing great. Let me just thank you for the invitation. And I am excited to share what I know and hope that it helps someone.
You're very welcome. How's Sky doing?
She is busy as usual and as always doing very well. Thank you.
Very good. Very good. I hope she sees this and hope she's just as excited. I will be just as excited to see you, giving your knowledge and helping others outside of your normal scope of where you typically help other people. So
Thank you.
welcome once again. So Dr. Wilson, can you share what inspired you to dedicate your career to helping families manage dementia, Alzheimer's, and MS?
I think it's a really good question because I feel like those particular diseases kind of chose me.
Okay.
I set out with an interest in neurology because I had, number one, a passion and an interest in the brain and in the powers of the brain and powers of the mind. But my area of interest did not start out related particularly to dementia. However, as my career unfolded, I saw more and more the prevalence of dementia, number one.
Mhm.
I think that certain neurologic conditions resonate with me. Multiple sclerosis, since I have family members with multiple sclerosis, is also a disease process that kind of chose me. And
Mhm. Mhm.
when I see patients, yes, with those particular diseases, but when I see patients who have their life function evolving over time, which is the case for both and many other neurologic conditions, it resonates with me very personally.
Yeah, let's talk about that for a second, because I know, and I hope you're comfortable talking about this. Your mom for years was under our care with Right Choice Home Care. And so talk a little bit about what your experience was first of all, learning that your mom had this debilitating disease. And then how did you and your, sibling handle it, or family handle it at that time? What was going through your mind? What was going through your brain as you were learning that this thing is I would say taking over your mom's body?
I think that I was witness to what happens particularly in African American culture, which is
Mm,
we won't claim it. We're going to
mhm,
use our faith and move forward. And so as
mhm,
we saw this condition unfolding, there was the turning away from what was happening right before us earlier on until we reached a point where we had a very, very uncharacteristic things happened acutely where we had to
Mhm.
okay, wait, something is not right.
Yeah.
Yes, we can ignore it if you
Yeah.
wish. However, I think we need to go to a hospital. And
Okay.
so, although there was talk of this condition for my mother, she'd actually received her diagnosis, I would say again,
Mm.
while I was a resident
Yeah.
with my program director of my residency. So it was a very I lack the word. It was just a very atypical, for lack of better wording, experience to sort of recognize that something was going on, but of course not really having much medical knowledge, but enough knowledge to know this is going to come back. This is going to come back again. We can't just
Yeah.
dismiss it. I knew that something was going on, and then to sort of go through that process of getting that official diagnosis again, but with understanding.
Mhm.
Um, it was jarring, and to watch the disease unfold was certainly an ongoing challenge. But again, even though it
Yeah.
was a trial, I think that that makes me more effective as a neurologist in a way that if you have not lived that, you would not understand. That's not something that is taught in medical.
Yeah. 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 And, looking back, and I can't really say I understood personally what you were going through, but we felt it, a lot of what you were going through, especially as mom's disease was changing and progressing. We saw a lot of that. But mostly what I did see, Dr. Jessica, is that you got up every day and you were still able to go and care for your patients, and you had this thing going on at home, but you got up every day and you left for work and you came back home and you took care of your patients as if nothing was going on at home. How did you do that? How were you able to do that?
Think, first of all, that wasn't easy, and secondly, I didn't wake up immediately there. It was it was a process, definitely, and I don't think you get there overnight. If you are a caregiver for someone, it becomes your rhythm, and that's the real challenge, I think, of caregiving is finding your rhythm. Once you find it,
Mm,
it is what it is. And you
yeah,
just you this is your normal, and that's fine. This is your normal. Can I participate when someone has an activity? As long as it's before this time, sure, let's go. But but I gotta get home.
yeah, yeah.
It works out.
Yeah, I see how you manage it. So, what do you find as one of the biggest misconceptions that families have either about dementia or other debilitating disease?
I think the fear factor of the unknown is the thing that causes diagnoses like dementia or even multiple sclerosis to be jarring and to be traumatic sometimes.
Mhm. Mhm.
And so if you were to tell someone that they have a condition that has the potential to worsen over time and that there are medications that might modify the course of the disease but cannot get rid of it completely, that sounds challenging, but at the same time, it sits better than for me to put a specific label to that because I just described dementia and multiple sclerosis.
Yeah.
But when you hear these terms, all you have is the stigma associated with the term or having never heard the term at all. So I think
Yeah.
the lack of knowledge is the hardest part and the biggest hurdle to be overcome with these
Yeah.
conditions.
Yeah, I would definitely agree with that because when, someone is hit with those words, it first puts that individual who's receiving it puts their body into a shock. It's shock mode, and then waking up from that shock and trying to figure out, okay, what just happened, like hit with a ton of bricks and try to, okay, what just happened here? Where do I go from here, and how do I help my loved one? As a triple board certified, yet you emphasize comprehensive general neurology and holistic approach. Tell me, is it the holistic thing? everybody or most of your clients receptive to that?
The short answer is no. I don't think that everyone appreciates that approach, but some people I find go out of their way to find that approach. When you're thinking of neurologic conditions, I'll use one that is of somewhat less complexity. Let's say migraine.
Okay.
You'll find some patients, you try one medication after another and find that they're still suffering from migraine. In my opinion, if you don't stop and think about, well, what is the driving force behind all of these headaches that you're suffering? Maybe, just maybe, the migraines are actually under control. Could these be tension type headaches with migrainous features that are being driven by the fact that you're a 27-year-old mother of three and your husband is
Mm,
off work right now, and all of these
mhm.
other dynamics that we sometimes don't recognize, they're
Yeah.
impacting you, whether you
Yeah, the
realize it or not.
stressors. Yeah.
Exactly. And if we
Yeah.
don't factor those things in and also look for those things, then we'll be
Mm,
forever chasing after one medication and then the next, never really
yeah.
getting rid of the problem.
Yeah. Just masking the pain and masking the
Absolutely.
symptoms. Yeah. So for
Absolutely.
caregivers, for caregivers, what does it mean to have a neurologist view their loved one's condition through this particular lens? So how does it change the focus from immediate symptoms to long-term well-being? You just mentioned, getting to the root core of the problem.
Think that that is the role that a neurologist should play. They have to, I'm going to make it personal. I have to understand the family dynamic. And because that's so important in caregiving as well, because when I take on the
Yeah.
responsibility of the patient, I'm taking on the responsibility of the caretaker as well.
Yes.
Because if the caretaker's not well, they can't give if they have nothing to give.
Yeah.
Because if their own life circumstance is overwhelming by one situation or another. But I need to be aware of those things. It's far beyond a prescription and it's far beyond a list of resources. I could tell you who to call, but if you've got seven other phone calls to make,
Yeah.
we're at square one every time I see you. So
Yeah. No, that's true. That's deep. And I have to say, I've I've been to or been around other physicians or even seen physicians myself, and I've never had anyone ask the question, how's your family dynamics? Never has anyone ever asked that. So for you to even start there to understand truly where this person's issue is coming from, I commend you because a lot of physicians don't even start there. I don't know if they think to start there, but they don't start there. So you're different. I have to say that. So
good. I'm
so
glad.
thank you for being you. Thank you for being you.
If
Um
I
f-
may add,
sure.
I think that's one of those things that comes from walking the path that I walked
Mm,
at home, and recognizing what my own emotional needs are. I can recognize exactly, not, I won't say exactly, but I can understand better what a person
mhm.
is feeling and thinking as they're
Yeah.
going through it. And I can kind of speak to that part. I
Yeah.
do think there has to be trust, and it's not for every doctor because, sometimes we enter that environment without the trust. And so
Yeah.
family members and caregivers for patients, they can confide information if they trust you, but you'll never really know what's going on if you have not created that kind of relationship.
That is so true. Building relationships is so key when you are it doesn't matter if you're a physician or a caretaker. It starts with building trust. And so if you don't have that trust, you're not going to confide in someone. In fact, you really don't want to be around that person if you don't have that relationship, right?
Very
So for someone newly diagnosed, what is the first practical step their family should take?
good question. Stop. That's exactly what they should do. Because your head is spinning because now you have the label for everything you suspected was going on anyway.
Mhm.
But stop. Stop and assess. I think it's important to begin to think about what the specific needs of your household are as it relates to the person who is affected,
Mhm.
and stop to assess who is on your team. That's
Mhm.
very important because it's
Mhm.
hard to walk this journey alone.
Yes.
I would warn that it just because the patient was a good mom does not mean that every child is going to be gung ho about this process. There are people who, you have the dynamics of, do we even live in the same city? Do we even live in the same country? Do we, I can recall a family in particular where son wants to be helpful, but he's struggling with alcoholism. So
Mhm.
one family member wants the help from her brother, but we have to kind of let him help in other ways, be supportive
Mhm.
because he's dealing with his own challenges. So figuring out who is actually on your team and also in what way. Because even if somebody is not able to help is not able to help every day, I should say, that wants
Yeah.
to, there's still ways that people can help. So figuring out who is willing and then also figuring out kind of matching what the needs are to what
Mhm.
people are willing to do. Sometimes that involves coordinating, and guess what? If you're asking the question, it's probably you that's being the coordinator. But I think one difficulty is expectation when it's not met. She's
Yes.
your mom too kinds of
Yes.
situations that come up, or this is your whatever the relationship is, and therefore you should. That doesn't always drive people to get involved and help.
Yeah.
And
Yeah.
also, people have different ideas about what dementia is, which means
Mhm.
that if you're the son that lives way out in the suburbs or in another state, and every time you talk to mom on the phone, she sounds just fine. When I turn to you and say, hey, I need some money towards supplies, I'm going, wait a minute. Mom sounds fine to me. What's going on with you?
Yeah.
So, those kinds of dynamics you have to consider as you're creating this plan.
We are currently in a fascinating discussion with Dr. Jessica L. Wilson Mohammed, a triple board certified neurologist at Loyola Medical Center. With her depth of experience across Chicago's top health systems, from Rush to Mount Sinai, and her focus on holistic, comprehensive general neurology, Dr. Wilson Mohammed has given us the kind of expert insight that is absolutely invaluable. But getting expert knowledge is only half the battle. You need support and resources too. I want to invite you to build your network right now. Join our free newsletter. I'll send you Dr. Wilson Mohammed's key takeaways, along with essential tips, guidance, and all the podcast updates directly in your inbox. Connect with us on LinkedIn. Search for the Give a Care LinkedIn group to network with the fellow professionals and caregivers who are putting this expert advice into practice. All the links to start building your support system are in the show notes. Take a minute to find the support you deserve. Now let's get back to our conversation with Dr. Wilson Mohammed. Yeah. I'm smiling and I'm nodding my head because, when we're did our few recordings prior to this when we talked about getting grounded, and I'm so glad that you are saying the first thing you need to do is stop. So for me, that's stop, get grounded, and then get out of the chaos. And you have no idea that, we even talked about any of this previously, but I'm so glad that you are saying these things to give understanding to the audience because it is so true what you're saying. It is sometimes hard for a loved one who's not near what's going on to refute everything that's going on because it's like you said, mom will sound normal over the phone, right? She recognized the voice, everything is okay because you're asking those how are you doing questions instead of digging deep into truly what's going on. But one of the things that I come to find out with dementia patient is that they are good at masking things. They are good at telling everybody the world is fine. And then when you go in the house and take a look, you're like, oh my gosh, what has happened here? You haven't eaten in days, months. The refrigerator hasn't been cleaned. Mom is not smelling too great because she hasn't taken a shower. And no one can even say, oh, well, I didn't know what was going on. I think I didn't want to know what was going on because you have an inkling in your mind when something is wrong. We all have that gut feeling, right?
Mhm, mhm.
But it's that, do I really want to know?
Right, right. That's true for some people, absolutely.
Mm-hmm.
And also insight. Insight refers to a person's own awareness that
Mm-hmm.
something is not right. And
Yeah.
for that individual who's living in filth because they have no interest in hygiene or appearing to live independently, you're right. Cross that threshold as a family member. Check.
Yeah.
Are we actually eating? Is our weight going down? What
Mm-hmm.
are we eating? Have we
Yeah.
taken care of hygiene? Are we hoarding?
Yeah.
Is this truly a safe environment? Sadly, for a lot of families, it's not until an incident occurs that action is taken. And that's one
Yes.
of the purposes of having a specialist, a neurologist of some kind, get involved because their role is to try to be ahead of the trend that can happen with
Mm-hmm.
neurologic conditions like dementia and like multiple sclerosis as well.
Yeah. So one of the things on the backside of being on the Right Choice Home Care and, talking to families over the phone, Jesse, I find a lot of times when families are calling, they're saying, "Oh, well, mom has dementia," and never even having gotten a diagnosis, much less even going to a neurologist to find out truly what's going on. What do you say to those people who are just using the term and using the signs and symptoms to then diagnose their own loved ones?
I would definitely encourage them to involve a specialist. I don't trust the label when I receive it because there's so many things that can affect cognition. And it could be that an elderly person doesn't have a 100% healthy brain, but
Mhm.
they might be able to function okay, but they might have a UTI. And what you're
Mhm.
describing or they might have gotten the label of dementia because a doctor who's meeting them for the first time in a hospital in the midst of confusion
Mm.
is not actually seeing what their normal is. And so they leave the hospital with that label and go back to
Yeah.
business as usual.
Yeah.
And now we're assuming that they're demented, and that's not always the case. So
Yeah.
definitely involving a neurologist to get that better understanding, but also to find out what kinds of resources are out there.
Mhm.
That's very, very important to know. Where do you go from here with that information?
Yeah, true. So, as a Chicago native, you've practiced across major systems, Rush, Sinai, Schwab. How does understanding the diverse local landscape help you better guide patients and families on finding the right resources? We just talked about resources, specialists, and rehabilitation centers in the Chicagoland area. I know it's a loaded question. So, you've worked in a lot of places, Jesse, but you had loyalty to a few for many years.
Mhm, mhm.
So, and you speak Spanish, you're fluent in Spanish, and I'm sure that has helped to open up the gates for you with new patients. So let's talk about that, the diversity of all of that.
Well, certainly each of the hospital systems that you referenced has a different demographic. There is some overlap. This is Chicago. We are
Yes.
quite a mixture of
Yes.
people. And yes, it absolutely does benefit to also be able to go past the barrier of language. Because in my mind, medicine is a language in and of itself. And so it's
Yeah.
doubly challenging for a person to first of all, have the barrier of not having knowledge of what this medical diagnosis means. And then add to that, that even if you explain it, do you explain it in a way that a person culturally can understand? So it is definitely beneficial. But one thing that I would say has been a good observation is regardless to what health system you choose, the resources are out there. And
Mhm.
so some facilities, I think, are more proactive in providing you with those resources and getting you connected to them. Whereas in other institutions, you may have to do some of the footwork on your own. And
Yeah.
so it may take just kind of being guided and doing your own research, a lot of your own research.
Yeah. It's just so much information out there,
There
for
is.
families, and misinformation, I should say, too. And families get confused a lot of times with the information or misinformation that's out there. And sometimes they just don't know what is true and what isn't and how to move forward. So, as a neurologist, from your perspective, what is the single most crucial piece of information a caregiver needs to get grounded on or after diagnosis, like epilepsy, early stage dementia, Parkinson's, or any other debilitating disease?
The most important concept to grasp, I think, would depend on which type of condition the person is suffering from. Um, I think we have a complex medical system. And so
Mm-hmm.
maneuvering based on what one's diagnosis is can be very challenging. So I think being able to trust a primary doctor is going to play a very, very important role. If you
Yeah.
don't feel heard, that may not be the primary doctor for you.
Yeah.
But a primary doctor is the first line to get a person connected to other resources in the community. Some people would benefit from having a social worker. There are resources that can be tapped into, and it isn't really fair to expect me as the individual to know what I
Yeah.
can and cannot have access to, or to even limit what's offered simply because, well, my insurance covers ABC and that person's is DEF,
Yeah.
you know, but all of these things are out there. So figuring out how to get access to what are the most useful in your individual case, I think that's probably the most important thing to do. And figuring out how to do that would be with the help of a primary care doctor.
Yeah. That is important. That goes back to that trust thing, right?
Absolutely.
Yeah. So you specialize in a whole lot of things, Dr. Jessica. Give the audience some of what you specialize in other than epilepsy and
Sure.
multiple sclerosis.
So I'm a comprehensive neurologist or general neurologist, which means that in the same way that a primary care physician sees their first line to address any medical issue and they get other specialists involved once they do their initial screening and testing, the same is true for me as a general neurologist. I am technically an epileptologist by training and certification. However, as a general neurologist, any neurologic question or complaint can come to my door. And if it's something that I directly manage, whether it, like I said, migraines or neuromuscular conditions, movement disorders, tremors, any of many Parkinson's, speaking of tremors and also speaking of dementia, Parkinson's can cause dementia. I'm the first line. And then if I feel like subspecialty perspectives are needed, that's when I would send the patient to other specialists within neurology or in other areas to try to optimize their care.
Okay, wonderful. So, for families managing seizures and other sudden neurological events, what is the most common tracking mistakes caregivers make? And what simple system or data point should they implement immediately to provide accurate information?
Think that seizures and epilepsy can be somewhat unpredictable, and medication and medication management and the importance of that is sometimes lost in the process.
Yes, yes,
So if someone is seizure free for a long period of time, they may think they don't need the medication or they don't need a neurologist, or a person is on a medication, it has been working, and maybe, just maybe, we're at a point where they don't need the medication, but out of fear, they continue the medicine without revisiting whether or not more modern options are available or if they even need the medication at all.
yeah,
So the number one reason for breakthrough seizures in a hospital is medication non-compliance. Before we're adjusting medicines or anything else, the first question I need to know is, have you been taking your medicine? And oftentimes, problem solved. Guess what? You take the medicine, you don't have a seizure. And it really is that straightforward in a lot of cases. So just recognizing the importance of medication management and monitoring overall is
Yeah.
really, really important.
Yeah. I'm glad you said that because we know that medication mismanagement also can land seniors in the hospital more frequently than not.
Absolutely.
They get home, they don't want to take their meds, they feel fine, and they're right back in the hospital.
Absolutely.
So, what are some of the early signs that families often overlooked or dismiss?
With regards to dementia,
Yes.
some of the earlier signs of dementia that families may downplay or overlook um, include car accidents, getting lost in
Mm,
areas where they should be that should be familiar to the person. Uh,
mhm.
Sometimes when we find that individuals forget, we dismiss it, and if they're asking us repeated questions over and over again, the same question, and
Yeah,
still not retaining the answer, that's a clue to pay attention to. Now, I'm not saying that as though that's the definitive diagnosis of dementia, but that
of
is
course.
something to pay attention to. There are some things like acting out dreams where a person, while they're sleeping, they're flailing and moving, or they're essentially moving their limbs in response to what they're dreaming about. And when we're dreaming, technically our bodies are supposed to be paralyzed, but they're acting out their entire dream. And sometimes that can actually be a clue to certain types of dementia and the development of them. And that can happen a full 10 years before
Yeah.
they actually have clear signs of a dementia. So paying attention to those things, even just mentioning it again with a primary doctor, just at
Mhm.
least creates a sort of timeline that begins to ask that question, could these pieces fit together and mean something else?
Yeah, thank you for that. So, when discussing prognosis of treatment options, families often feel rushed, right? So, what are two top questions you believe every family should ask their neurologist before leaving the office to gain clarity and prevent future anxiety? Because we know that's the one thing that people feel, even coming into a doctor's office, is anxiety.
I don't think that the management or treatment of dementia is something that needs to be rushed. And oftentimes it depends on the comfort level of the patient.
Mm-hmm.
I have patients who are fearful of medications or don't desire to add another medication to an already extensive list, or no medication at all. So why should I start one?
Yeah.
So
Yeah.
you have different perspectives, but dementia is a chronic condition. So kind of
Yes.
following along with the patient and gauging how they're feeling
Mm-hmm.
and what family is observing. I don't think that anything needs to be rushed, but
Mm-hmm.
I think that families should be encouraged to have awareness, pay attention. There's a lot of things we overlook
Hmm.
because, as we mentioned earlier, some people they do such a good job of appearing so-called normal that we don't
Yes.
really recognize something else is going on.
Yeah.
So being watchful is very important because that threshold for intervention, a person who is having these situations may not recognize the help
Yeah.
they need.
Yeah.
It is essential for the caretaker to be the advocate for the patient because the caretaker knows the patient better than anyone else. It does not mean that the caretaker should be a hindrance, however,
Mhm.
based on what the caretaker, he or herself, does not know. So, out of the caretaker's own lack of knowledge or fears, they may withhold potential treatments just out of uncertainty. That's not the same thing. Advocating is not saying no to treatment options when they're presented. Sometimes advocacy is representing the voice of the patient to whoever it is that's involved in the patient's care. I think the most important balance is on one side, the independence part, but on the other side, the safety part. Giving too much independence is letting go of the safety component that is when you have to step in
Yeah.
a bit more. So there are individuals who they're adamantly opposed to leaving the home that they are familiar with, even if they are living alone, even if there are safety concerns.
Mm-hmm.
In such a case, there are strategies that one can use. And even in saying that, I also have hesitation, because I think that if safety is compromised at a certain point, you have to step in. You have to step in before something bad happens.